Good afternoon, ladies and gentlemen, and welcome to this information session on the Public Health Laboratory of Austin, Texas, affectionately known as PHLOAT. PHLOAT is a public health laboratory, which means we address any threats to the health of the general public. We are part of the Laboratory Response Network, which is a network of labs set up in the late 90s and early 2000s to respond to bioterrorism threats especially, but also to public health emergencies in general. The Public Health Laboratory Network is set up as a pyramid. The Sentinel labs are the labs you're used to dealing with. They recognize and rule out. If they cannot recognize a pathogen, they will refer it to a reference lab, which is what we are. We do confirmatory testing. If we determine that the threat is great enough, we will kick it up to the federal level and allow the CDC to determine next steps. We serve the citizens and residents of the state of Texas, including the Native American population and anybody who finds themselves in the Texas environs. We are located in the capital city of Austin, Texas. Our normal hours of operation are from 0800 to 1700, and we do have a 24-hour emergency response unit for any exposure events. Here at PHLOAT, our mission and vision statements help us define what we do. Our vision statement is a short statement for the general public to give them a good idea of what we're trying to accomplish. Our vision statement is to serve and protect the health and well-being of the people of the state of Texas from threats of disease and disaster. Our mission statement is more of an internal document to give us a set of goals to shoot for. I won't read through this whole thing, but I'll go over the salient points. Our main scope of service is to monitor public health threats. These may include pathogenic threats, radioactive threats, environmental threats, chemical contamination, especially of the groundwater, and most importantly, genetic threats to newborns, such as inborn errors in DNA. We also do training for the general public and for healthcare workers on what to do in the event of an exposure, as well as how to properly wear PPE, since most of them don't have proper training on this. We also offer a set of 24-hour emergency services in the event of an exposure, and we will coordinate with federal authorities and local authorities to ensure the safety of the public. PHLOAT is a biohazard safety level 3 laboratory. This is what our general workstation looks like. We have so many safety measures in place because we deal with potentially lethal diseases, especially those that can be transmitted by respiratory transmission. We also offer medical surveillance for all of our personnel in the event of accidental exposure, but our most important safety measures are our respirators and biohazard safety cabinets that keep any accidental exposure to a minimum. We also filter our exhaust air to ensure that we don't transfer pathogens into the general environment, and we are required to have self-closing and locking doors.
We at PHLOAT consider ourselves to be very lucky to be affiliated with several federal agencies and not-for-profit organizations, the first of which is the Clinical and Laboratory Standards Institute, followed by the Food and Drug Administration, the Environmental Protection Agency, the Federal Bureau of Investigation, the Department of Homeland Security, the World Health Organization, and last but very important to our cause, the Centers for Disease Control and Prevention. We chose to ally ourselves to these organizations because we believe that their guidance is invaluable in helping us manage bioterrorism threats and public health crises, all while maintaining the quality that is expected of a public health laboratory. In addition to affiliations, we are also accredited by several regulatory agencies, the first of which is the Centers for Medicare and Medicaid Services, and through them we ensure that we are following all of CLIA's mandates. We also have the Joint Commission and the College of American Pathologists. And through abiding by their strict standards, we will continue to be a laboratory that is worthy of public trust. Here we see our CLIA application, where we had applied for a certificate of accreditation acknowledging that we are a public health laboratory performing non-wave testing. At the end appears the signature of our laboratory director, Dr. Matthew Crockett, who is undoubtedly the proudest Texan that I have ever met. As eager as we were to submit our CLIA application immediately once our laboratory director signed it, we figured we should probably let the ink dry first. So after that excruciating wait time, we were finally able to send it in the mail to the CMS. A few weeks later, we got back that we were approved in the form of this certificate of accreditation that was sent in the mail. Here we can see that it was addressed to, wait a minute, does that say Public Health Hospital of Austin, Texas? We're not FAT, we're FLOAT. It appears there was some sort of mix-up at the CMS. So we got them on the phone, and turns out they did send us the wrong certificate of accreditation. And after a little bit of begging, they sent us the right one in the mail for the Public Health Laboratory of Austin, Texas. Just like we always wanted it to be. FLOAT is certified to perform high-complexity testing with an estimate of 12,000 tests performed annually. Our specialties include microbiology, that comprises the majority of testing done. However, we also have tests specializing in immunology, chemistry, with an emphasis in toxicology, and hematology.
Here at the Public Health Lab of Austin, Texas, we pride ourselves in the variety of tests that we offer, such as Helicobacter pylori, OraQuick HCV, and OraQuick Rapid HIV testing, Sofia Flu A and B, syphilis testing, respiratory film array, chlamydia detection, and so much more. As with any laboratory, the testing is only as good as the SOP written for it. We take extensive care in producing the most accurate and complete procedure manuals as possible. They are carefully written by our staff, extensively researched by our quality assurance personnel, and each one is personally vetted by our laboratory director. Nothing is left for chance in our facility, which is why all reagents, chemicals, and testing is covered by their own SDS documents. FLOAT uses state-of-the-art instrumentation, such as Sofia fluorescent immunoassay analyzer, mainly used for wave testing of rapid influenza A and B. This instrument is capable of several different types of rapid testing and can be expanded in the future. The BioFire film array is an LIS interface analyzer capable of molecular diagnostic testing. The BioFire film array respiratory panel is capable of identifying 20 targets in one test with a runtime of about 45 minutes. The Tigris DTS fully automated system to run our Aptima chlamydia testing, capable of full molecular testing with direct tube sampling. The Vitec MS automated mass spectrometry microbial identification system that uses matrix-assisted laser desorption, or MALDI-TOF technology, to identify an array of microbial organisms. The Vitec 2 is an additional microbial identification if needed, but processes the majority of our laboratory's antimicrobial susceptibilities. We're always looking for the latest and greatest laboratory testing to date. This is why we have partnered with National Genetic Institute on the UltraCrawl 1000. Their priority system has just passed FDA approval in 2018, and we are the first to offer it in a public health setting.
The laboratory information system that FLOAT uses is CompuGroup Medical's LabDAC. It is a system that is renowned for its user-friendliness and dependability by over 40,000 different customers. Some of the features that it includes is that it can track QC data, flag results that are outside the reference range, and backs up and secures all data. This feature is of particular interest to us because we deal in threats to public health and national security, so we must ensure that our information does not fall into the wrong hands. Thus, CompuGroup Medical's LabDAC is the correct LIS for us.
FLOAT's organizational structure has 4 units with subsections, all reporting to the assistant director, and the laboratory director. Our clinical laboratory unit has 3 main subsections: microbiology, hematology, and immunology. We also have an emergency response unit, an environmental health unit that is mostly comprised of chemists, a training and outreach unit, as well as consultants and officers to deal with our more specialized needs, such as epidemiology, technical consulting, quality assurance, and lab safety.
We at PHLOAT take pride in our careers and career development. Here are some of the positions we offer and a small description for each.
At PHLOAT, we require that on the first day, each new employee must go through orientation with their direct supervisor and discuss the employee handbook and workplace policies with the Human Resources Department. Training relevant to the position must be completed within 1 year of being hired. It is our goal that each employee feels comfortable in the workplace and feels equal to their coworkers. We hope that they understand their role in the organization and have the skills to complete their work and succeed.
Employee competency is required by everyone in the laboratory. The laboratory director or the designee will certify that each person who works in the department is competent to perform the functions to which he or she has been assigned. Competency will be assessed for non-wave and wave testing with all testing personnel at the beginning, after the initial 6 months, and each year thereafter. Records of competency reviews will be kept in the individual's personnel file. The competency assessment includes the following: direct observation of testing and performance, record reviewing, monitor test results, proficiency testing, performance of maintenance, and problem solving.
Here at PHLOAT, we take safety very seriously. Our injury and illness prevention program details how we provide for the safety of our employees. All the duties of our safety personnel are detailed in this document, including the duties of the assistant laboratory director, our lab safety officer, lab supervisors, and testing personnel. The plan elements are as follows. We detail standard precautions for pathogen safety to prevent the spread of pathogens. We detail our PPE and laboratory design, especially the design of our respirators, our impermeable gowns, nitrile gloves, laminar flow biohazard safety cabinets, and impermeable lab surfaces that allow for easy decontamination. We also have a chemical hygiene and hazard communication plan that details how we handle hazardous chemicals, as well as how we label them so all hazards are communicated properly. We also detail medical surveillance for any possible accidental exposure, and we have annual training on all of our elements to ensure that our employees stay up to date with any changes.
PHLOAT expects its employees to remain cognizant of changes in their field. All testing personnel must earn 45 continuing education units every 3 years, regardless of the organization that they are certified with. There are multiple ways to obtain CEUs, including 15 total from annual safety training, an unspecified amount earned each year from one compensated conference, and an accredited college or university's coursework, where 1 credit hour is equal to 10 CEUs. However, this amount earned cannot exceed 50% of the total required CEUs.
Thank you for taking the time to enjoy our laboratory. Please feel free to contact us if you have any questions. You can reach us at the following, or visit our website at www.coa.gov/float. We look forward to hearing from y'all, and maybe in the future working with y'all as well.